Hi. I'm going to ask you all over again. Tell me what happened.
Okay. Well, I can even remember the date. It was October 20th. Woke up in the morning, could not move my neck whatsoever. That lasted, the severe pain of it lasted a couple of weeks. It's subsided a little bit, but still have pain. It's been hurting quite a bit now because I've been doing a lot of shopping. When I'm looking up and around to shop and stuff, it tends to get very tight and painful in the back of my neck.
Okay.
Got to the point where the pain comes down here and then also is in the top of my shoulders. I think it's because I'm doing this tense movement.
Okay. And you had x-rays done?
Yes, I did have x-rays done and they came out normal.
Normal, good.
Went to my own doctor and I couldn't move my neck at all. They gave me some shots in my neck and shoulders, which I don't know if it really helped because it took about 3 or 4 days after that for things to go down a little bit. Also had an adjustment, but I couldn't go back to get the adjustment in the neck anymore because the pain was just too bad. So that was early October. It subsided a little bit, but still occurs every day. I work. I have 2 monitors, so I'm constantly looking back and forth to the monitors. And by the end of the day, at nighttime, it's very, very painful. Sleeping is difficult. And
Pretty sore now?
It's sore now, yeah.
Which motion is the most difficult?
I would say the turning of the neck, or any kind of this movement or turning of the neck is the most painful.
Yeah, you mentioned turning first too, so we'll use that as our test to try to figure out what's going on. That doesn't mean we won't do another test. Okay, slowly turn to the right and let me know when you feel the problem.
Right in there.
Okay, back. So this seems to be happening first. Let's check that versus go to the left slowly and tell me when.
Okay. So feeling it there and into the shoulder a little bit.
And something happens here before the other two. So that was the third thing that I think is happening first. And you can feel the pressure right underneath my finger when you turn. This 7th cervical vertebra is not moving and is the way it should. It's hardly moving at all. So I'm going to hold pressure on it. And you're going to feel, it'll feel pretty icky in there. Not really painful per se, but it'll feel very different. And you're probably going to, it's real close to a bundle of nerves called the stellate ganglion. And you're going to get a flush feeling into your shoulder and maybe even down to your hand. Okay? It'll feel kind of weird. Not fun, but not really painful per se either. So I'm going to work my way in past that C7 TP, lateral mass, posterior, bump into the vertebral body, right on the surface there. I'm right at the inferior cervical ganglion and the middle cervical ganglion. Now I'm just going to hold some pressure there. Feel a little icky in your shoulder?
Yes.
Does it go to your hand yet? There, it's moving now. You might be able to tell it just kind of all of a sudden started to give way. You're turning a lot farther right now.
Yeah.
Try turning
I
both.
just noticed that.
Try turning both ways.
Oh, yeah.
Better?
Yeah.
Okay. Okay, turn to the left. Yeah, see, you're going farther, and now this one has popped up again. This side isn't moving correctly. And it's the rotators and multifidus right in here on the back that makes you feel it locked on the front. So let me have you line your back again. So you could feel the pressure and the blockage come on the front of the spine and the mid-cervical area. And it felt like longus colli, longus capitis, and anterior intertransverse muscle, but it was really the multifidus and the rotators that were doing it. And then when I get farther over, I feel the superior oblique limiting the motion. So I'm switching to the superior oblique. I'm just following where the tension is that's limiting the motion. So there were, yes, mostly muscles
Okay,
doing that. Once I freed up the muscles, those joints in the vertebra, the facets, are moving fine now.
okay,
So it's not, yeah, for you, it's not a matter of adjusting those,
okay,
because that's not where the problem was. And they're moving fine once the muscles let go.
okay.
Yeah, you look a lot more relaxed now.
Yeah, I feel it. I feel like my shoulders are actually
Yeah,
like laying down a
they've
little
dropped.
bit instead of, being up to my
They're
ears.
not protecting. And
Right,
mhm.
great,
Yeah, all this into the shoulders was a compensation
right,
from trying to support
yeah,
that.
okay,
Make sense?
great. Thank
Okay.
you very much.
Mm-hmm. Nice to meet you, Lorraine.
Nice to meet you too.